Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Cefaclor. Its brand name is Ceclor. And before I talk about this medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Cefaclor. We'll then touch on some examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Cefaclor is a beta-lactam antibiotic in the cephalosporin class. By binding to penicillin-binding proteins located inside the bacterial cell wall, it inhibits the third and last stage of bacterial cell wall synthesis. Cell lysis is then mediated by bacterial cell wall autolytic enzymes such as autolysins. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of infections of the skin and or subcutaneous tissue. As well, patients with acute bacterial exacerbation of chronic bronchitis may use this medication. Acute otitis media may be treated with this medication, as well as lower respiratory tract infections. Finally, patients may also use this medication if they have pharyngitis or urinary tract infectious diseases. With respect to contraindications or reasons we would not be able to prescribe Cefaclor, we wouldn't give this medication to a patient who had a hypersensitivity to Cefaclor or to any other component of the formulation. As well, we would avoid this medication in patients who have a hypersensitivity to other cephalosporins. Now for some examples of dosing with Cefaclor. So in the treatment of acute otitis media or an ear infection, we may see 250 to 500 milligrams of the regular release formulation given orally every 8 to 12 hours. For an infection of the skin or subcutaneous tissue, we may see 375 milligrams of the extended release formulation given every 12 hours for 7 to 10 days, or alternatively, we could see 250 milligrams to 500 milligrams of the regular release formulation given orally every 8 hours. For a lower respiratory tract infection, again we may see 250 to 500 milligrams of the regular release formulation given orally every 8 hours. As with all medications, there are some side effects or adverse reactions that patients may experience while using Cefaclor, so we'll go over some of those here now. One common side effect would be diarrhea coming in at 1.5%. Some serious side effects would be Stevens-Johnson syndrome, toxic epidermal necrolysis, Clostridium difficile colitis, hemolytic anemia, or serum sickness. Alright everybody, that's all we're going to talk about today with Cefaclor or Ceclor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.